When you walk into our office, you will see that we have a display not only with our dry eye treatments and eye supplements, but also with makeup and skincare products. And so we often get asked, what is the display on makeup and skincare doing in an optometry office? And my answer is, we're wanting that question. I have a subspecialty in dry eye and ocular surface disease, and in researching those treatment options several years ago, I and some of my colleagues began to notice that there is a severe lack of regulation on the ingredients that are put into our cosmetics and personal care products. The problem with that when it comes to your eyes is that we use so many products on our face and around our eyes. So I want to give you a few examples of some things that we're always looking for, especially in our patients who are symptomatic, but also just in educating patients as a whole. What I want to tell you is that I have gone and made a brochure, and so I'll kind of go through some of the things that we talk about here, and you can always stop in and grab a copy and ask more questions if you'd like. One of the main things that we look at in women is getting makeup removed. We have meibomian glands that are located along the lower lid margin and upper lid margin, and these glands are so very important. They secrete the oils that comprise the outermost layer of your tear film and keep everything else from evaporating. We need these glands to work well so that every time you blink, you get a little shot of oil which coats the surface and makes your eyes comfortable and your vision clear. When you apply makeup or any other product to that surface that is toxic, you potentially clog the gland or cause damage. So leaving your makeup on leaves all of that residue that clogs the gland and may be toxic. Some of those most common toxins that we look for are, so we have that listed in our brochure, formaldehyde releasers, which are often found in lash extensive glues, mascaras, also found in shampoos and things like that. But the big ones we look for is the mascara. And unfortunately, they don't label it formaldehyde on your mascara tube. It will be labeled as DMDM, hydantoin, quaternarium 15, or the ureas. So I like to use the app EWG skincare app. It's called EWG Skin Deep, to look up to see what ingredients are in what I'm using. So I brought in Beautycounter a couple years ago because at the time they were one of the only companies that were really leading this act. Since then, there have been a number of others on the market, so choose one that suits your needs. I also talk a lot about eyeliner, and a lot of these eyeliners are made from tar or coal black. And the biggest thing is you should not be putting these on your waterline. That's where we used to tight line. Big no-no. You introduce bacteria and you also clog the glands. Concealers and other products need to stay below your lash line, and be careful about getting those too close. And when we look at eyeshadows, we consider mica and where those come from, and some of those sparkly eyeshadows are made from mica that are actually very fine particulate matter that are sharp, and when those get into the eye, they cause irritation in the conjunctiva and can even become embedded. As much as we try, unfortunately, as the day goes on, a lot of our makeup does migrate down to that lid margin and gets in the eye. So the next thing is, it's very, very important to take your makeup off properly. So Beautycounter does make an oil-free makeup that is free of parabens and all of the other toxic ingredients. But the one I hear about the most is people still using Vaseline, and that is a petrolatum product. So petrolatum is very toxic and damages those meibomian glands. And it also clogs the glands because you're putting a very thick oil or ointment on top of those glands, so the oils that you're making don't secrete out. So where this comes to play in my practice is we can have people that we're treating and have done everything right, and then we figure out that changing up one product on their face, for instance, can all of a sudden clear up our symptoms. Another common ingredient are the lauryl sulfates, which are the ingredients that causes the facial lather when you use your soap. That's especially detrimental for people with rosacea and ocular rosacea, as it is a surfactant that will kind of create friction, and it can actually exacerbate the inflammation on those leaky blood vessels, and it can cause an inflammatory response around the eyes. So we've had cases where all I did was change up somebody's face soap and their eyes got better. So those are pretty easy fixes. What I like about Beauty Counter is that they have their never list of over 1,800 chemicals that they never use in any of their products. And they really are leading the movement to get better regulation on the market, because unfortunately you can't trust the labeling. That's not FDA regulated. So something that's organic or dermatologist recommended really doesn't mean anything. So they have great products. They have a wonderful eye cream that is a plant retinol, which has proven to be just as effective as a regular retinol. And retinol is one of those ingredients, when you look it up on the EWG app, rates a number 9, so that's bad. Retinol is very, very damaging to the skin and causes a lot of reactions. So we like to stay away from that. If you have other questions about any of the products you might be using or how that might be contributing to any eye symptoms, certainly call our office and we'd be happy to help you out.